I approach patient care by talking to the patients one-on-one and making them feel comfortable and helping them open up to me and telling them what their real problem is and express, what their real discomfort is and why they're there. So you kind of get down to everything that's going on with the person. So I like to address every problem that they're having. I think a lot of times people are very embarrassed to talk about sensitive issues, especially with a female provider. And I try to tell them that a lot of people have these issues. So it's okay, and that's why you're there, is to get help. And that's what I'm there for. I think they're often surprised at how much easier it is to talk to me than they think it is. And we kind of, I try to lighten the mood and I just say, hey, you'd be surprised at what I know and how I can help you if you just tell me what's going on. And I think once I break the ice and, just kind of lighten the mood and just kind of get straight to the topic at hand, they always open up. I haven't really ever had a person who hasn't. Just know that I'm going to do whatever I can to help them. Yeah, and I'm going to treat them like I would treat myself or my family. And that's what I always tell them. I always say, a lot of times patients will say to me, well, what would you do if this were you? And a male patient will say, what would you do? And I say, well, if you were my dad, or if you were my brother, or if you were someone in my family, this is what I would do. And that's exactly how I treat people. And I don't ever treat anybody different than I would want to be treated. So I spend that time with them on how I would treat anyone in my family.